Yeah. Yeah, because the quarantine thing's kind of hard to explain.
All right. We're just waiting to
Hello,
get started.
everybody.
We forgot how to do this.
I know. I'm
Right?
trying to wait for you to pop up on my...
Am I not popped up yet?
You go.
All right. We are waiting to figure out how to do this again. Oh, hi, Meg.
Here we go. Oh, I don't have the app anymore. I can read the
Okay, we can watch the comments there.
comments, I think. Dang it.
Hello.
I hate the Facebook app.
Hi, Teresa. Hi, Leanne. We have official permission to call Mrs. Githens Leanne. I just want to point that out in case it sounds terrifying to anyone else.
I ever saved it my phone as Mrs.
Oh, I know, right?
Mrs. Githens.
Hi, Annette. Hi, Kathy.
I can't do it. I have Aaron Chard saved as Mr.
Yeah,
Chard
that's it. Yep.
as well.
Mrs.
Yeah.
Rogers.
Mrs. Rogers will always be Mrs. Rogers. Yes. Yeah.
All right. Well, we're going to go ahead and get started. It looks like people are showing up here. Hi, Debbie, and hi, Lisa.
I'm just gonna do it on my computer.
All right. So we have a few topics that we're going to cover today. We're going to kind of stick to these topics unless there are any other questions. So we'll kind of wait for any questions you might have. Hi, Dr. Newkirk. And so we're going to cover the new CDC guidelines for quarantine. We're also going to cover the new vaccine, how it works, all of that stuff. And then we're also going to cover our mask mandate in the county. So please put up any questions that you have. And thank you so much for you guys joining us and for all the hellos and congratses.
Congratses.
Yeah,
It works.
Let's go congratses and the hey-heys. Hey, Casey. All right, so we're going to start off with talking about the CDC quarantine.
Yes. So, part of the reason we wanted to do this today is because this is kind of hard to explain, and it's going to get probably confusing when we are calling you to quarantine. So, we wanted to just kind of give a little explanation here. CDC's new quarantine guidance has changed from 14 days to 10 days. Just across the board. So we know that most people, when they are quarantined, will develop symptoms in the first 10 days. So that's why CDC's kind of decided to change that.
So I guess I do want to start off with they do say that 14 days is still the safest. So if you're like, hey, I want to be super sure that that I'm keeping everyone safe, 14 days is still the safest. So but we see quite the decrease in risk after day 10. Sorry,
Yes.
I want to throw that one in there.
Good point. Because the PCR test, which are the tests that we've been doing since the very, very beginning, they are still nasopharyngeal, right? Yeah. So they're when we were talking about these ones, these like way deep swabs, that's the ones we were talking about. Gosh, like 9 months ago when we started this. So that's the type of test you have to test into a shorter quarantine. So if you have quarantined for 5 days and you are still not showing any symptoms, you are eligible to get a PCR test and then only quarantine for 7 days, assuming the results of that test are negative.
So, yep, and I think through the biggest themes are throughout all of this, 14 days is still the best. 7 days is the bare minimum that you would be in quarantine. Nobody is in quarantine less than 7 days. And also, this only works if you're asymptomatic, that you have no symptoms, no headache, no nausea, vomiting, anything, loss of taste or smell. If you have any type of symptom that could be a COVID symptom, then this does not apply to you. It also does not apply to long-term care facilities and corrections facilities like prisons and jails. So if we were to go with overarching themes, we want to remember those things right off the bat.
Yep. Yeah. And
how about the 10-day? Same thing. Well, without the testing. 10 days.
Yeah, 10 days without testing. But again, the whole thing is as long as you don't develop symptoms, which is what the 14-day was as well. But they've just shortened it a bit, or given us the option to shorten it a bit.
Yep.
So that's what we've done here in Wilson County. Jen and I talked about it, and we talked about it with the Board of Health, the county commissioners, and we were all pretty much on the same page there. So
I think the other important thing about this is that really what we're striving to do, and what we think the CDC is trying to do, is that we're trying to keep people at work, because we know it's a strain to be out of work for 14 days. We're trying to keep people at school, because again, we know that is tough, and we want people to realize, hey, we're trying to make this doable, because it's tough. We know it's tough on everybody, and not everybody can just quarantine for 14 days and it doesn't hurt you, financially or anything else. So we're just trying to do our best to work with our economy and work with our schools to still keep people safe, keep them at work, keep them at school, but not compromise health and safety.
Yep. And Mrs. Githens would like us to remind of the procedure to get tested. In general, anyone who wants to get tested can get tested. If you call your doctor and you get an order, the labs can bill your insurance. So that's the way we recommend that you do it. If you don't have a local doctor or you don't have insurance, you can call the hospital directly and get scheduled for a test that way. These tests that are required for the quarantine, the shortened quarantine, the 7-day quarantine, they are a specific test. So when you call your doctor, you will have to call your doctor for these. It can be pretty pricey if you don't. We recommend you call your doctor, order this specific test, and then let the hospital know that that's the test that your doctor's ordered for you, so that and the reason that you're getting tested, and just be as upfront with the hospital as possible, because you do not want to get stuck with a bill for one of these tests.
Right. And just say, I need a PCR test for the shortened quarantine. And if you say that to your doctor or to the hospital, like that's what we're looking for anyways. What we have been doing is what we call the antigen test, and that's kind of the rapid test, but the gold standard of testing is still the PCR test. And so PCR for shortened quarantine, you say that, we know what you're talking about, and we can get an order in there for you. That's not to say always that your insurance is for sure going to cover it. It's still not a cheap test. The antigen testing is cheaper, but that doesn't get you out of quarantine also. Okay, so those are just really important things to remember, because this shortened quarantine, again, is something that you can do, but we have to follow all the rules that go along with it. Do you also want to talk about how once you go back, you're out of quarantine at day 7?
Yeah, once you're out of quarantine at day 7 or day 10, we do still know that the incubation period of this virus is 14 days. So we definitely would like you to wear a mask. Whenever
you need to wear a mask.
You need to wear a mask. Not we would like you to. You need to wear a mask. In general, but for sure for the 14 days. And then you need to continue to monitor yourself for symptoms. Definitely keep an eye out for fever, headache, allergy symptoms. That's kind of how this tends to start, even stomach upset sometimes. So really keep an eye out for those symptoms for the next 14 days, because you conceivably could still develop them.
Yeah, and we've made recommendations to businesses that if they have employees that are coming back, document what they're doing. Document that they've had their temperature checked that day, maybe twice in that day would be great, and also that they aren't having any type of COVID symptoms, and have those list of symptoms posted somewhere so that people know what to watch for. Really, truly, we're not seeing people with like a fever most of the time. We're seeing people with what they think is a sinus infection, or they think is allergies. That's almost always what we're seeing. So So Michelle, you asked about how many in the community seem to turn positive after day 7. I think we can talk about this.
Yeah, we don't have community specific data. Just haven't gotten it.
Yeah. So it's kind of we try, but that's a lot of data. But
it is a lot. Yeah.
The CDC has some data. Look at this nerdery right here. So the reason that the CDC feels as though we are able to do this is because once we get to day 7, your percent chance of transmission with a negative test is anywhere between 5 and 12%. I read that yesterday, by the way. I've been studying. So at day 7 with a negative test, the risk of you transmitting the virus to somebody else is 5 to 12%. It's not nothing. I mean, that's still a decent amount. At day 10, without a negative test, your risk of transmission is anywhere from 1% to 10%. I know that's still a range, but we're working with the data that people have gotten, around the world. And so we know it's not just, it's exactly 2%. We know there's a range there. So in general, your risk is much lower when we're talking about days 1 and 2, right after, as part of your quarantine, we're talking about transmission into the 60 and 70% there. So much higher, but then as the days go on, we see that you're far less likely to transmit to people.
Yeah.
That sound right?
Yep.
Yeah.
Sounded good to me.
I have to give a shout out to Dr. Steinschauer, who just joined us. She is a pulmonologist and intensivist in Wichita, so she's really taking care of a lot of our patients there. And so thank you for joining us. This is a shout out to you, Dr. Steinschauer. So that is the shortened quarantine. We kind of went through that quickly. It's on the CDC website. It's on the KDHE website.
It's on the Health Department.
It's on the Health Department Facebook page. So please let us know if you have any questions about it. And we are officially doing that in Wilson County. But it doesn't change anything about like contacting the Health Department. It doesn't change anything about, someone had asked about what if you have someone in your household that has COVID. Does your quarantine start still after they've recovered? And yes, you wouldn't start this, even the shortened quarantine, you wouldn't start until they've hit their recovery. Recovery is exactly the same. Still minimum of 10 days after the start of your symptoms with a significant improvement in symptoms, and you have to be 72 hours fever-free without fever-reducing medicine. So those are all the same. Nothing changes there, but this is just for somebody who is simply a contact of a positive without symptoms.
Yes. Along those, just one last parting thought for quarantine. Anyone who is in quarantine now, who was put into quarantine like a week or so ago, if you have questions about your specific quarantine, don't hesitate to call us. We're getting lots of those questions. Frankly, we can't catch up fast enough to get it to get a hold of everyone and change their quarantine. So if you're already in quarantine and you think it should be changed, then get a hold of us and we'll work with you on that.
All right. I see Sharon asked, what if prolonged headaches occur? And I assume that's after you've gotten COVID and you just have this headache that holds on. And truly, we've seen that in our patients, that we have coughs that hold on for way too long, weeks even, for some, we've had a couple of months worth of symptoms after COVID. And we've said this all along, that it's not just about life and death. Did you survive COVID? It's about all those lingering symptoms that can happen. So if you have a prolonged headache, that is something that's important to talk to your doctor about, actually, because is there another reason for the headache, or is that truly your COVID that is lingering and just kind of those symptoms that are holding on, which would mean that you don't have a significant improvement in symptoms. So please, when you're not sure, if you have symptoms that hold on, call your doctor and always call first, right? And talk through it to try to figure out if those are COVID symptoms that you're still dealing with. So, All right. Right. Okay, let's talk a little vaccine. And again, keep putting up questions. Hello, everybody. Hi, Michael. And Christy, our classmate, she's out in Mayo, at Mayo.
Yeah.
Yeah, doing cool things there. Dr. Godwin, look at us. I tell you, us Fredonia ladies.
I tell you.
Look at us go.
Taking over the world.
So we're going to talk a little bit about the vaccine now. So I don't want to go into the hardcore nerdery because that's a lot, but
it is a lot. I heard it the other day.
Yes, and Destiny's like, don't do it, please. For the love of all that is good and holy. Okay, so I'm looking at my little notes here, but so there are two vaccines that are really kind of out right now, the Pfizer vaccine and also the Moderna vaccine. So both of them use new technology for, thanks Carissa, both of them use new technology for the vaccine. They're using mRNA. And what that means is that they are, where'd my little slides go? I know this stuff, we'll just go through. So what that means is that the mRNA is injected in the vaccine. So it's no longer a part of a killed virus like we see in flu vaccines. It's no longer a live virus that we see in like a shingles vaccine. This is, it's the genetic instructions, I guess, for the virus. So it gets put into your body, it goes into the cell, and the cell then produces, it has these instructions now, and it produces the little spikes from this virus. Oh, I'm already going nerd. I'm so sorry. It's just like,
you can't talk about this without going nerd.
No, it's so nerdy. Anyway, so then it releases these little spikes basically into the body. The body recognizes that it looks just like the spikes that are on the coronavirus, and then it recognizes these spikes and starts building antibodies to the spikes. So when your body does come into contact with coronavirus, it sees those little spikes, already recognizes them, already has antibodies, little security guards to come and take them out. And so then you don't end up with the infection, or you end up with a much less less severe infection. So,
thanks, Sheldon.
So many good comments. So the important part about that is like they were able to produce this quicker than most viruses because they didn't have to grow these little parts of viruses in chicken eggs and things like that. They were able to just genetically create these little instructions. And they were already working on this technology anyways. And then they were able to try this out on tens of thousands of people. And so in those tens of thousands of people, like for the Pfizer vaccine, there were like 95, something like that ended up with COVID. And of those 95 that ended up with COVID, 90 of them had the placebo, and 5 of them had the actual vaccine, and none of them had severe infection. So that's where they came up with the numbers that they are 95% effective, something like that. So those are really good numbers. They're very promising. It seems that these vaccines are very safe. And so that's, Mrs. Graham, see, science nerds. That's why this is different, and so it is a little bit scary for people because it's new territory. But we're finding that it's a safe way to create these antibodies and keep people safe. Okay, are you going to get the vaccine, Des, when it comes out?
I'm going to get the vaccine. There was a question about the side effects that they're saying people are having. What about the pretty strong side effects they're saying people are having after receiving the vaccine?
I've heard that too, and yes, what we've heard is that it feels like a really bad hangover. I'm not saying that I would know what that feels, or Destiny for that matter. Let us move on very quickly. But yes, they say like you feel pretty bad for like a day or so, and then that's it. And we'll know more as people actually get the vaccine. But yeah, be prepared for that. But in the long run, hopefully that is a better option than actually getting coronavirus.
Yeah.
Right?
Yeah.
See, I'm so sorry. I promised Destiny
No,
I
that
wouldn't
wasn't
go
that
like,
bad.
It wasn't
that
bad?
wasn't
Okay.
nearly as bad as Monday. You guys should have heard it Monday. That was
She's so excited.
big time science nerdery.
I'm gonna tell her all about it after we stop our Facebook Live. So
when will we know how long the vaccine lasts?
That's a good question.
That's a very
Brooke.
good question. These trials are like typically on a vaccine trial, and I'm sure they will on these too, they will continue to do trials to test like the efficacy over 2, 5, 10 years. We just don't have the time yet. And that's kind of how all vaccines kind of work. Like the flu vaccine, you have to get it every year because it doesn't last a long time. We have no idea if this vaccine will be one of those, or if it will be more like a MMR that you get to and it'll last your whole life. So
We will find out.
We will find out.
I did see a study the other day that people who have had COVID, their antibodies are thought to last, more like 8 or 9 months.
Oh,
I mean, again, that's the data we have, at this point. So, we're trying to find out information as we go along. So, we always try to address comments that are put up there. I know that people are trying to do their best in our communities, whether it's businesses, our governments, our schools, and it's a really hard time, and we're trying to work with people also. So if you do have concerns, let us know, and we'll be happy to address them along with that entity. But we truly believe that there's not a single person out there that's doing anything maliciously, and it's just a really hard time, and lots of information out there.
Yeah, and we've talked about these outbreaks. They're gonna come in waves, and they're gonna, we saw a lot of activity in Neodesha. Then for a little while it was Buffalo, and then it was all Fredonia, and now it's kind of all over the place. But I would expect that we'll see, like spikes in numbers in one town and then spikes in numbers in another for a while. So it's not all complacent. It is truly who you're around. We just had Thanksgiving. We're seeing lots of families and extended families kind of being in quarantine and then kind of testing positive. So we, we kind of expected that. We expected that to happen. And so hopefully that'll calm down soon.
Deb, you asked about any pre-existing conditions that would keep one from considering getting a vaccine. At this point, no. Really, we're going to be giving the vaccine. What we've heard is the plan is that healthcare workers and long-term care facilities where they're the most vulnerable people, and probably they have the most chronic conditions, those are going to be the people who are going to get the vaccine first. So whereas you might have had an egg allergy before, or you might have had a problem with another vaccine before, this does not seem to have those contraindications anyways to getting the vaccine.
And as far as availability, on a KDHE call today, they said they expected Kansas to be getting their first doses this month. So I don't see any. The biggest delay I think that we'll have in Wilson County is that our population gets us a smaller allotment, I think is how that sometimes works. We haven't actually been provided all the details yet. So I guess suffice it to say, as soon as we have it, as soon as someone has it, we will get the information out on how to get it. It is not going to be mandatory countywide. I don't know, individual employers may require it, individual facilities may require it. I don't know about that, but my knee-jerk answer would be no.
Going back up, I think Diane's maybe. So it is it is 2 injections. So the first one and then 2 months later.
I don't know the details.
Yeah,
to be
I forgot if it was 2
honest.
months. But yes, it's 2 injections, so you get to be hungover twice, Diane. Yeah, not mandatory. If you have had COVID, should you get the vaccine? It's a really great question. Most likely, we're going to recommend that people still do get the vaccine because, again, we don't know how long the immunity lasts because we just haven't had that much experience with the virus at this point. So
if mom gets a vaccine, long-term facility, does that mean we would be able to go inside and see her and hug her? That's the hope. I mean, that is the whole point of getting them vaccinated. They are the most vulnerable population, and we know that they are struggling in more ways than one right now. So it will definitely be a fantastic first step to make. Oh, Michelle's answering the question. It'll definitely be a fantastic first step. I like to think of the vaccine as the beginning of the end of the pandemic. It's not going to just end when we all get the vaccine, but it's the beginning of the end. It means there's a light at the end of the tunnel.
Yes. And so Michelle says it's actually one is 3 weeks later and one is 4 weeks later. Thank you so much, you guys.
Thanks.
Will we start?
Wear masks.
So I would say, so the question was, once you get the vaccine, will we still be required to wear a mask, thinking back to the flu vaccine? So the answer for right now is yes, because we still need to see what is happening with the vaccine, with immunity, with people building immunity, if it's still going to be spread as much. And like Destiny said, the hope is, yeah, we do away with masks. We never have to wear them again, hopefully. But once you get your vaccine, it's still going to take time for everybody to get their vaccines and for us to get enough people vaccinated for it to not be spread so readily.
Yeah.
Even though you get the vaccine, we kind of talked about, you can still get it. It hopefully would be less severe, but you can still get it. So in the short term, yes, it's a really great question, but hopefully in the long run, no, we won't have to wear a mask.
And as soon as you're injected with the vaccine, it's not instant. It takes, the flu vaccine takes 7 to 10 days to, build enough immune response in your body to be effective. Lots of vaccines take a week or so. So just as soon as the needle comes out of your arm,
don't rip off the mask and be like,
yes, yeah, you're gonna have a couple weeks. And what those side effects are your immune response to the vaccine. So.
All right. Sharon, you asked about frontline workers, and by the way, Brittany, we know you're an awesome nurse. You knew all of that stuff, but we just want to make sure that everybody knows that. So Sharon, you asked about frontline workers such as maybe school employees. Would they be up there at the beginning, front of the line to get the vaccine? That's actually some of the discussion that's been around about our schools and teachers. Are they considered that first level of people getting vaccines? And so it's at this point they say healthcare workers are, and then the most vulnerable. Our hope is that they will be toward the front of the line, because we know our teachers are working hard, and every staff member, John Boss wants one, so every staff member in our schools, they're truly heroes right now, doing hard work to keep our kids safe. So we're big believers in that. We hope that is the case, but we also really just want everyone to get vaccinated too.
Yeah.
Other questions? Let's just do a quick overview of the current mask mandate. It started on November 25th. That was last Wednesday. It's a 30-day mask mandate, and so we know that not everybody is still wearing masks. Our intention is not to fine people and not to give people tickets or anything like that. But we do hope that having a mask mandate sets the expectation of our community as a whole, that we believe that this is something that helps decrease the spread, and we hope that people will even just give it a try for 30 days. We're in a big spot of Thanksgiving and holidays, and this is the easiest thing we can do to just try and slow this thing down.
And I know not everyone's wearing masks, but I have seen a lot more masks going in and out of the courthouse and at the grocery store and convenience stores, wherever I've seen a lot more. So it's, I think, been effective in that way, that it just raises awareness more than anything else, really. They're doing clinical trials on vaccine for ages 18 and under now, correct?
Yeah, I think they're still, we've learned that the younger people are less affected by the virus. And so that wasn't, they're working on that now, because I think they wanted to get the adults vaccinated first.
Yeah. The highest risk groups, I think, are the first priority, I guess.
Yep.
I don't think Diane thinks it's helped. That's good.
Right.
And Diane, I want to give you a shout out. We've actually had some people come by the health department and get some of the masks and hand sanitizer that you've been handing out. Diane, anyone who doesn't know her, has been going all over the place to businesses handing out masks and hand sanitizer and all sorts of nice little yummy goodies. And
yes.
Well, I got yummy goodies. I don't know if anyone else did, but I got chocolates and Oreos. and
so
we appreciate that so much. It's very selfless of you. Thank you.
All right. Well, man, we said we were going to keep it under 15 minutes. We're so bad at this game, aren't we?
We are. We're really bad at.
But we want to answer your questions, so that's
why we're always late.
I know. Are there any other questions? Last call. All right. When we do have the vaccine come out, we will likely maybe do another one of these. We're just trying to come in when we have new information, and we just want to share it with you guys. Carissa, you mentioned, have you heard about mRNA vaccines being safer than others? I snuck one in. Sorry. Yes, I like that you snuck that one in. At this point, we believe it's really safe, but I guess because these are the first two, or the first of any mRNA vaccines, we don't know. So I'd like to think that they are, but that's the reality. We don't have the decades and decades of data like we do for pneumonia and flu vaccines.
It's probably safer than the first smallpox vaccine.
Yeah, I know, there were some questionable ones out there. So,
yeah,
but
if you don't know about the very first smallpox inoculation, look it up. It'll gross you out.
And we're dealing with something that's not even part of the virus, so that's good. You technically cannot get the virus, or you can't get the infection from the virus. So that's
you can't get the infection from the vaccine.
From the vaccine. Sorry.
We're trying to talk too fast.
It's been a while since we have to. Oh, thanks, Carissa, for being satisfied.
All right.
Yes. All right.
Well,
thank you, guys.
Thanks, everybody, and we'll be back when we're needed, like little superheroes. If there is a need, we will be there.
Thank you.
Thanks.